Back around this time in the summer of 2020, the movement Defund the Police started gaining significant traction after the death of George Floyd, and therefore protests against police brutality. Even before that, activist groups wanted to reallocate police budgets towards social services and things like education, housing, and health care. Essentially, money for law enforcement would be moved to community initiatives. Cities that have reduced police budgets over the years included New York City, Los Angeles, San Francisco, Portland, Oregon, and Austin, Texas. Now, though, the topic is being heavily discussed in the media because the most recent New York City Democratic mayoral candidate, Zohran Mamdani, a self-proclaimed Democratic socialist, wants to create what he's calling a Department of Community Safety to, quote, prevent violence before it happens. On his campaign site, he says he wants to deploy dedicated outreach workers in 100 subway stations. So what exactly does that mean? Well, to find out, let's welcome in Dr. Mina Miram, a board-certified psychiatrist and an assistant professor of psychiatry at Columbia University Medical Center. Doctor, welcome. You're very familiar with this topic, most recently attending an event with both healthcare professionals and law enforcement. Before you discuss what was covered at that event, let's discuss this campaign initiative from Mamdani. He's in your own backyard, correct?
He is, Joe, and thank you for having me. This is an initiative that's causing quite a stir, I think, around New York City, because anywhere you go around New York, there is a sense of an increased need for public safety. And every police officer I speak to, or every civilian I speak to, voices this concern, whether there is an increased, violent incidents on the subway or just kind of day to day. So there's a concern that says we really want to be strategic around making sure that we feel more safe around the city. And the big question is, how do you go about doing that? And that's why this campaign promise is, raising some eyebrows, I would say.
All right, we should add that in New York City in 2020, they shifted approximately $1 billion from the New York Police Department budget to mental health, homelessness, and education services, and crime actually increased. Doctor, paint our audience a picture of what this looks like. Police and mental health providers collaborating. When a male adult is in a busy intersection, wielding a hatchet near businesses and schools and threatening to kill people, this man is off his meds, so we can't contact the support system because he doesn't have a phone on him. 911 has been called, so law enforcement shows up, but they have to wait until a psych nurse actually shows up as well to join law enforcement. Doctor, my wife is a psych nurse. I couldn't imagine her showing up to this trying to manage with law enforcement. So share with us your idea of what a scenario like that looks like with a collaboration, and then talk about some of the activities and topics you guys discussed at that recent event.
Yeah, absolutely, Joe. And I can tell you from all my years in psychiatric practice and seeing patients in the emergency room every single day, that's where that patient will wind up, in my emergency room, somebody who is now off of their medication and in a place of distress. So the first question is, the name of the game here is triage. The name of the game, the same way that you walk into an emergency room, we got to know how to deploy our resources for a gunshot wound versus, a psychiatric emergency. So in that example, there is no replacing the police response. There is no replacing police presence to stabilize a situation that is chaotic and dangerous for everyone. And in addition to that, the same way that when you get a 911 call and you got to figure out as a dispatcher, do you send the fire department? Do you send the police? Do you send an ambulance? Do you send everybody all the time? In the best case scenarios that we see around the country, programs in Oregon or in Philadelphia or in Denver or places that I've seen in New York City, is figuring out, here is the prioritizing or the triage status. In the worst case scenarios, you need police doing what only police can do, right? In some scenarios, what police officers will tell me, I don't want to waste my time necessarily, frankly, Dr. Merholm, that if somebody has never had a history of violence and there is no threat of violence, I want the ambulance to respond before I do. Or I want somebody who can de-escalate a situation for somebody with autism, for example, before I do, because I don't feel like that's the reason I went into policing. So the question here for us is really balance. So we don't want to be in a place where we're defunding the police or taking away resources from law enforcement because we need them desperately. However, what I hear a lot from police officers is, give me the support when I'm in a situation that is not quite this risky standoff, right? Where there is a question about suicide, and I don't want to be walking somebody off the ledge. Or as one police officer told me the other day in that program, I saw somebody overdose on medication and I wasn't sure what to do about that. And I didn't feel like it was my place to figure out the lithium level of this person. I wanted another healthcare professional alongside me. That's kind of the question that we're trying to balance together.
Yeah, and doctor, correct me if I'm wrong, there's also that factor of people like us on a subway train, somewhere in the middle of nowhere, an intersection, and we see someone acting like that in a drugstore, in a grocery store, I don't know, a church, wherever, and you're thinking, I don't know if I want to get involved in this. They seem like maybe they're unstable. So I'm just going to walk away, call 911 and walk away instead of, try to react and try to save other people, like sort of the subway train situation with that former, that Marine that ended up, being on trial for that. So one of the New York Police Department's unions reacted to the Mamdani campaign suggestion with this. The Detective Endowment Association, DEA, told the New York Post, quote, "We intend to make sure elected officials wake up to the power of our uniforms. Our words can move the public to participate in politics and to support officials and candidates locally and statewide who support public safety," end of quote. What should public safety, doctor, look like in 2025 and beyond, not just in New York City, but other areas as well, especially with the Trump administration cracking down on deporting criminal illegal immigrants in certain communities and removing public safety threats? And let me add to this. I mentioned one of those cities earlier, Austin, Texas, about their budget in defunding the police from $434.5 million in police funding for its 2021 budget down to $292.9 million with funds invested in housing, healthcare, family, and mental health services. I'm sure if you ask anyone, doctor, we don't have a problem with that. Let's clean up the city. Let's get those people off the street, get them the help they need. But city leaders in Austin, Texas, reversed course and increased the police budget to $443 million the following year. So what works, what doesn't? Is that what health professionals like you are trying to figure out?
Yeah, Joe, I think this is the thing is that health professionals like me, whether we're in the hospital or whether we're in the community, we know we need law enforcement and there is no replacing police presence. When there's a situation of safety is paramount and no doctor, no nurse, no social worker can do the work they need to do if they don't feel safe, frankly, right? Part of the stigma that we want to reverse a little bit sometimes is that folks who are struggling with mental illness, our friends, our family, our community, we sometimes automatically label them as dangerous people, but the data tells us that they're in distress. They're not, oftentimes the ones who will commit violence. Oftentimes they'll be the victims of violence. But part of what will change that is the presence of someone who can make a situation feel safe. I think what we advocate for in the medical community is there's a phrase that I always think about, that these things you should have done without leaving the others undone. We shouldn't need to be defunding the police in order to better care for our community and make sure that people have housing or healthcare or basic other human needs. We want to really figure out how we can put our hands together. That's why when I'm sitting with a police officer, I don't want to be responding to a call by myself. I don't want to just be the one going there myself. And I don't want them to feel like they're going to go without backup from healthcare as well if somebody is in a psychiatric sort of concern. In the ideal world, we have a well-funded police system. We have law enforcement doing what law enforcement does best, and we can back them up because at the end of the day, in New York City, for example, there was a big initiative around rounding up folks who are struggling with homelessness and bringing them into the hospital. So, okay, that's one step. But now what do we do from there so that we prevent them going into a jail or going into having the same cycle again? Because part of us, the humanitarian component, is wanting to break the cycle that winds up having the same people going through the same dance of between a jail or a hospital or homelessness. That's the part that we want to work on together.
Yeah, and I think anyone would agree. We're sick of seeing videos online of police showing up to a situation like that, begging, asking that person, put the knife down, put the gun down, put the hatchet down, and they just refuse and they attack police. And of course, we know the outcome to that. So we want to see less of that and more of trying to figure out how to get those people off the street before they go to the hatchet situation. Dr. Mina Miram, always great insight, always developing this topic, especially during times of voting for the public. I'm sure it'll come up again. We appreciate your insight always. Thank you.
Thank you so much, Joe. Always a pleasure to speak with you. Thank you for having me.